Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the January 20th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total is about 11,400 cases, with 496 cases reported in the last 14 days. All age groups are experiencing new cases, but the 19 to 24-year-old age group continues to have the most cases since January 1st, with about 12%. Meanwhile, over 1,200,000 cases and almost 19,000 deaths have been reported nationally in the last 7 days. What other time in history have we ever tolerated this amount of deaths in this short time frame? I can't think of any, except maybe 9/11. And that rate of deaths is well under these numbers. I think the death statistic, and it's more than a number, these are all people whom we all know and love. This astounding number of deaths should influence our actions, our social distancing, hand washing, mask wearing, and all the other mitigation strategies that are required and optional. We must do our part to stop the spread and the number of deaths. And remember, death is the most severe end result of COVID-19. There's still plenty of pain, suffering, and everyday life disruption with COVID-19 illness. Dubuque County continues to receive vaccine from the Iowa Department of Public Health and is making great progress on vaccinating the healthcare workers in Iowa Priority Group 1A. The Iowa Vaccine Shortage Order requires us to only vaccinate healthcare workers at this time, and we've completed about 93% of the healthcare workers with the vaccine the Iowa Department of Public Health has allocated to us. Keep in mind, as a county incident management team, we don't have the ability to request how much vaccine we're allocated from the state. We get what we get and we don't mind a bit. Well, of course, we would like more, and we continue to receive vaccine allocations because we're getting vaccine into people's arms, and we still have healthcare workers in Priority Group 1A to do. Plans are underway with our local vaccine providers to vaccinate those in the newly determined 1B priority group. We will be setting up a community pod, or point of distribution, where we can efficiently vaccinate those 75 years and older, along with the others named in Priority Group 1B. However, we are not yet taking appointments or names for waiting lists, nor are the clinics or hospitals. When we know when and how much vaccine we will be getting, we'll get the information out on how to make an appointment and where to get vaccinated. Dubuque County hospitals and clinics are involved in this planning and the community pod, so please do not call them wanting an appointment because they can't do that yet. So let's talk about the vaccine itself. Both the Moderna and Pfizer vaccines have shown to be two of the best vaccines developed to date. Effectiveness rates of 95% after 2 doses. This is similar to the effectiveness of the measles and chickenpox vaccines. Also, both Pfizer and Moderna are still monitoring their phase 3 participants to see if the virus can be transmitted or spread from people who are vaccinated. Another way of looking at this is, will this vaccine prevent disease and infection or transmission? All other vaccines do that, so chances are this one will too. But in the meantime, and until we have evidence that you can't spread the virus after you're vaccinated, we're asking everyone, including those that have received 1 or 2 doses of the vaccine, to continue the safety measures of masking up, distancing, and quarantining if you're exposed. Bottom line, the vaccine will protect you from getting COVID-19 disease. And finally, a word on vaccine safety. No vaccine exists that does not have some risks. And when you think about it, pretty much nothing in the world is zero risk. But we always must weigh the benefits against the risk. The vaccine benefits of not getting COVID-19 disease or spreading it to someone who could die from it, these far outweigh the main side effects of a sore arm, a day of a slight fever or fatigue, or other minor side effects. I haven't received the vaccine yet, but I have no doubt that I want the vaccine as soon as it's available to me, and I also want it for my family. And by the way, that sore arm or slight fever, those slight side effects are signs that the immune system and vaccine are working and developing protection against COVID-19. Yesterday, we remembered those who have died from COVID-19 as bells in Dubuque and throughout the country tolled for the number of deceased. Today, January 20th, 2021, we witnessed an historic presidential inauguration with public health mitigation strategies in place. I know hope is not a strategy, but let's hope and plan for future inaugurations and other important ceremonies to be held without all these public health protections, limited attendance, and extraordinary security measures. We, as an incident management team, are well aware that many of our COVID plans may soon be changing with the new federal administration and leadership. But what the heck, we've been learning and constantly changing course during this whole thing anyway, so if we get new directives and strategy, we will roll with it. As we close today, keep in mind our ever-changing COVID-19 situation and the good work we're doing to keep Dubuque County cases from increasing. So continue to avoid swapping air with those outside your household. And be mindful of keeping your distance when out and about in the community, especially at indoor places. We've stuck it out this long, so let's continue on this path of safety and resilience because we're all in this together.